We've come here today just to engage on the issues. The pandemic, as there is a surge again in COVID-19, and as we speak today, we have another case today. Our caseload now stands at 85, and we said we have to sit down and revamp our strategies. So the meeting we had today was to consult with the technical teams so they can help us come with the best strategies to combat the second surge of COVID-19. We also discussed on issues pertaining to issues raised by a section of health workers that we saw in the streets 2 days ago, and we've deliberated quite on almost everything that touches on the safety and the lives of our people. As a department, our goal is to put a smile on the face of the patient. Cannot wait any longer for the donation from France. So as a COVID committee, we had a meeting yesterday. We had continued to discuss today. We have collapsed quite a number of projects to ensure that we buy oxygen plant as early as in the next 1 or 2 weeks, so our modern state-of-the-art ICU can start operations the soonest possible. So with other issues that were raised by health workers, we have combed through them, and we've been able to resolve everything. I think everything that was raised we have discussed, and we are able to handle 100%. Yes. We are ensuring that we will up again our awareness. We will continue to teach our people through media and through continuous health promotion to know that this is real. It is coming, and this time around it's a killer disease. Even if we have to buy some kits, we are willing to go back into our budget, probably buy 1,000 kits, and then it will take us somewhere. Because now the problem nowadays is shortage of kits across the country.
Up to now we have spent around 120 million, so we still have 100 million to go. 121 million to go. And we are also concentrating in Samburu East. We are concentrating in Archers Post. We're also concentrating in Baragoi health centers to ensure that even the people in the sub-counties are getting services. They are getting services. We're also having the Mara Polytechnic Isolation Center ready. Will be in use from Monday next week. The Laikipia University Isolation Center will also be ready. They're also waiting to be handed over.
So far, COVID Fund has spent 107 million out of the 228 million that was earmarked for COVID intervention. So of the 107 million spent, 80 million was spent in health, where we spent 63 million on ICU and the equipments that were bought there and the 300 bed capacity, 10 million on PPEs and on renovation. Other monies that were spent were on water department and also on training, surveillance, contact trace. For the PPEs, okay, the surgical masks have run out of stock, so we are planning by Monday. We are procuring surgical masks. We are using direct procurement to make sure that the PPEs that are running out of stock are stocked. So for the PPEs, as from next week, we will not have problems with PPEs.